I remember sitting at work and I felt like my body was very, very weak. I went to get blood work and I received a call stating that it's close to organ failure.
wAIHA is an autoimmune disorder which leads to red blood cell destruction.
I was by her side as much as I can be. I was also concerned if she can have a baby.
You come from thinking like your life is over to just having birth alive. So I met my husband at work and we just struck the conversation. I was the initiator.
I was actually surprised. I wasn't used to that.
It was me. It was all my job. So he was very standoffish. So I kind of found that attractive. He didn't want to talk. He was just like playing hard to get. And then I reached out to him on Facebook.
So I'm all about just working, straightforward, getting to the point to work, do my work. And she just said hi to me and glanced at me. And I just said hi as well.
In the very beginning, it was his looks. He was handsome. He was always like making sure I was okay.
She was very friendly. She was beautiful, of course. Her beautiful long hair, her smile. So I actually felt, that she was the one. I proposed to Maria a year later at Pruitt George Park.
So I did an initial consult and the doctor came and said, so we're gonna put you in for surgery like right away because this is not looking good. And after the surgery, once you heal, like maybe 2 weeks later, we're gonna start on the chemotherapy. It was a colon resection.
My reaction was I felt worried, very worried, and I felt sorry.
So I was very hopeful because my surgeon, once the surgery was over, he was able to remove the whole mass and told me everything was clear. So I remember sitting at work and I felt like my body was very, very weak. I had nausea. I couldn't work. I thought the cancer came back.
So yes, I started seeing the same symptoms and always strongly encouraged her to seek and do her blood work, of course, and that would determine the results, which is important.
I went to get blood work and I received a call from Dr. Irina stating that I need to get admitted. It's close to organ failure. My name is Maria and I have warm autoimmune hemolytic anemia.
wAIHA, or warm autoimmune hemolytic anemia, is an autoimmune disorder where the immune system produces antibodies directed against red blood cell antigens, which leads to red blood cell destruction and consequent low blood count or anemia and associated symptoms. To diagnose wAIHA, you need to establish evidence of anemia, red blood cell destruction, and immune basis of the anemia. A cornerstone of making diagnosis of wAIHA is positive direct antiglobulin test or direct Coombs test, which is a test that looks for presence of pathogenic antibodies on the surface of red blood cells. The symptoms of wAIHA include fatigue, shortness of breath, palpitations, and symptoms of red blood cell destruction or hemolysis, which can include jaundice, yellowing of the skin, darkening of the urine, and formation of gallstones.
So when I asked Dr. Irina, how did this come about, she said it could be because of the chemo treatment. She also said that I may have had this from young. It's just coming out now.
The cornerstone of treatment of wAIHA are corticosteroids. Typically, corticosteroids are initiated and continued for at least 2 to 3 weeks, with 70 to 80% of patients responding to therapy. Once the patient responds to therapy, we taper corticosteroids slowly until they're discontinued.
So I received an infusion during my stay at the hospital and was monitored by the nurses. And I also had large doses of prednisone.
Tomatoes, feta cheese.
It's important to treat her early to prevent complications such as end organ damage. In addition, early treatment would prevent worsening of the anemia and need for subsequent therapies, including blood transfusions.
I was by her side as much as I can be. I would give her body massages and just be positive at all times, distract her with what she likes. She loves to eat desserts, such as ice cream. And I would always prepare healthier meals for her and smoothies as well.
He was always in the kitchen trying to make me like beets, because they said beets are good for your hemoglobin. He was always making me beet juice, cleaning after me. I didn't have energy to clean the house, so he did that. He was just very supportive.
Every patient has their own unique set of symptoms that can be associated with wAIHA, and listening to your body is important to identify these symptoms because they can be different in different individuals.
Dr. Irina always says, because we're so young, we don't want to go to the hospital, or we ignore every symptom we have. She says, always listen to your body, because even if it's something so small, because of my condition, it can mean something bigger. So it did work, the infusion did work, and after the hospital, I didn't have to continue the steroids because my hemoglobin was back to normal. So I was having the same symptoms. I was feeling nauseous, very weak, tired all the time. So I reached out to Dr. Irina again, and I'm like, oh my God, it's back. I don't feel good. You always told me to listen to my body. Can you please send me to do blood work now? So I went back for the third time, and Irina came and reached back to me and told me everything looked fine to me.
wAIHA causes significant emotional distress for patients and their families. The disease is unpredictable and relapse can happen anytime.
And so she repeated the blood work, and then she called me and said, "Are you sitting down?" And I said, "Yes." And she said, "You're pregnant." So I thought it was impossible because I couldn't have kids. And I was very happy, confused.
And of course, I was in shock. I was very shocked. I was eating a salad and my appetite just went down.
And he dropped everything he was eating, and he said, "What? I thought you couldn't have babies." So I said, "Yeah, pregnant." And I gave him the positive test, and he just said, "I'm not hungry anymore."
It was just mixed emotions. I was also concerned due to her medical health if she can have a baby. So there was some concern there.
In terms of complications that we can see in wAIHA, they include maternal complications such as high blood pressure, preterm labor, and fetal complications such as growth retardation, increased risk of miscarriage, as well as increased risk of hemolysis in a baby caused by transplacental passage of the antibodies from mother to fetus. In addition, treatment options for wAIHA in pregnancy are limited since we are not able to use majority of immunosuppressive agents that we typically use in wAIHA, and treatment is limited to use of corticosteroids as well as supportive therapy with blood transfusions.
You come from thinking your life is over to just having birth a life, and you're there for her, and you get to live your life with no regrets, or just thinking that tomorrow is not promised. She definitely is a blessing, especially with all my conditions and having a healthy child. It's For me, it feels like she's a blessing. That's why we named her Mila. Mila means miracle in Spanish.
1, 2, 3.
Since I strongly felt it was a gift from God, everything was gonna be okay. I felt good about it. And I just wanted to make sure that she had a healthier diet throughout the process of her being pregnant.
Treatment outcomes for patients with wAIHA have improved significantly in the past 20 years. We have newer therapies which improve relapse-free survival and keep patients in remission longer. Those therapies are more targeted. There is a number of novel therapies with different mechanism of action.
No.
I think Maria's story is a story of hope, despite all the challenges that Maria has gone through in her life, including cancer diagnosis at a very young age and pregnancy complications. She had very successful pregnancy without developing a relapse of her wAIHA.
Brush your hair?
So I think it's a story of hope that we can treat people and they can be in a long-term remission and lead normal life even after a quite adverse diagnosis.
We're always thinking negative, and you always have to be hopeful that everything is gonna be okay.